You're watching CBS 2 News in high definition.
Every parent knows taking children to the doctor's office is not always a lot of fun, but what if your child actually looked forward to going? CBS 2's Whit Johnson introduces us to a Westchester pediatrician whose patients are singing his praises.
Hey kids, how are you? Not so well today, huh?
Pediatrician Pete Richel has developed a unique treatment for doctor's office anxiety.
But I don't think you should be afraid. The stethoscope for your heart was made.
Cheerful songs and funny routines to help ease the pain of his young patients.
He's a little bit too funny.
For 4-year-old Zayan and his younger brother Daniel, a dose of laughter is exactly what the doctor ordered.
It's an easy thing to do and soothes them and makes them, I think, less fearful of coming to the office.
Dr. Pete, as he's called, is chief of pediatrics at Northern Westchester Hospital in New York.
Tyrus the virus was a mean old dude. He was obnoxious and totally...
Really?
Yes.
Songs like Tyrus the Virus.
Is there strep below? Hey, I really want to know.
And Is There Strep Below combine his love for music with his desire to heal. But they're not just for entertainment. The songs educate kids about their bodies and walk them through the checkup so there are no surprises.
If we're always open and honest with them and prepare them, then they'll be better suited and really less afraid.
It makes the trip to the doctor a little easier for parents, too.
He has a way with changing their moods from cranky to being pretty happy.
Zayan and Daniel were even happier to hear their cold symptoms could be treated with rest and fluids. The toughest part? Convincing the kids it's time to go home. Whit Johnson, CBS 2 News.
Dr. Pete says he considered a life in the theater but chose medical school instead.
Live from Studio 7E in Rockefeller Center, this is News 4 New York.
A warning about pet food and young children. For the first time, the Centers for Disease Control is reporting a link between salmonella found in dry pet food for dogs and cats and salmonella infection in kids. The agency found that almost half the patients who became sick with salmonella between 2006 and 2008 were 2 years old or younger. And while dogs and cats sometimes don't exhibit severe illness, the infection can be dangerous to infants and the elderly.
As most of us know, good hygiene with hand washing, and hand washing is really the key. Other measures that can be taken are feeding pets not in the kitchen.
Well, the results were published today in the September issue of Pediatrics.
This is Eyewitness News, the news leader, with Bill Ritter and Liz Cho, Scott Clark with sports, and Lee Goldberg with the exclusive AccuWeather forecast. Now, Eyewitness News at 11.
You know, one of the great things about being a new dad again is the discovery of all the great opportunities in our area for babies. Classes, groups, equipment. It's really never ending. The newest trend is really fascinating. Gyms for babies and toddlers. Is it too much? Too soon? Is it worth it? Here's Kimberly Richardson.
1, 2, 3.
This is the modern-day take on gym class. In this case, toddlers jumping, climbing, and balancing oh so carefully here at 74th Street Magic. The philosophy, healthy body, healthy mind.
They get the energy out in a safe place that's structured, which is really important. You got to be careful on the beam, you got to go through the routine, but you have fun while you do it.
Being active, something experts say a growing number of parents are concerned with given the rise in childhood obesity. Ronalise Camera has been bringing her daughter Carson here for about 4 months.
Times are different and kids are doing so many things that they didn't do necessarily before. Do I think it's absolutely necessary? No, I certainly don't. But I know she loves coming and I know it's really good for her. I've seen a lot of positive changes.
Dr. Pete Richel is chief of pediatrics at Northern Westchester Hospital and says children do benefit from classes like these, learning socialization and listening skills, but he cautions parents any physical activity they introduce their kids to must be age appropriate, especially now with programs in place for little ones as young as 6 months.
Not much call for that, although it's available, in early infancy. Once we have toddlerhood and say 18 months and beyond, parents should provide lots of opportunity for them to have their natural activity.
In order, he stresses, to master at this age movements like running, walking, swinging, and tumbling.
Well, we all know the benefits of exercise: increased bone and muscle density, improved heart and lung function. But what's interesting is there's not much data out there in terms of large-scale studies focusing on kids 8 and younger, what they do and the effects. But experts do know physical activity alone will not prevent obesity, saying the best plan is a multi-pronged approach, one that also includes healthy eating. Kimberly Richardson, Channel 7, Eyewitness News.